So in your practice, you prescribe testosterone for women that need it.
Absolutely.
What are the, I guess, symptoms? I mean, how does a woman know if she's low in testosterone, aside from the blood work or whatever you run?
So testosterone has many physiological effects in the female body. Mostly it drives libido, intensity of orgasm, clitoral sensitivity, that's proven. Women will feel like they have a lack of energy, they have a hard time losing weight, or they just don't feel as toned as they used to.
Okay.
Remember, testosterone is anabolic in men and in women, so it helps reduce body fat, it helps protect lean muscle, but mostly it drives libido in women as well.
Okay, now, you know, I think we're in the green room.
Right.
And I say, you know, I read books about testosterone, like it's a miracle for certain women.
Right.
And you chimed in and said, oh yeah, I see it in my practice.
I see that in my practice. If you get women's testosterone level optimized, Randy, a lot of them will have a dramatic improvement in libido, and it makes a world of difference. And I also,
I mean, they tell you, or like, what do they say?
oh yeah, I'm now having sex with my husband again, or I'm now having sex with my spouse. Or I just had a woman email the other day because I had to increase her dose because in her starting dose, she didn't feel as good as we expected. So you have to recheck the levels or recheck her levels. We increased the dose a little bit, so we balanced her hormones perfectly. And now she's like, I got my libido back. Thank you very much. Other women you see that have a lot of stress in their life, they come in, what I tend to see is they have high cortisol levels, which is the stress hormone, and they have low testosterone. So you have to balance their hormones. You have to lower the cortisol levels. You have to bring up the testosterone, but it may take a little bit more time. But we do absolutely see dramatic differences in women when you give them testosterone. It makes it.
So what are the other classic symptoms of a low testosterone?
So
libido,
correct.
losing strength, muscle.
So lean body mass, obviously, weight loss, energy. Testosterone affects mood. All hormones affect mood. So a lot of times these hormones work synergistically with each other, so it's not just one hormone. But certainly women will notice, even in their early 30s, I have patients who come to me in their 30s, Randy, and they say, my libido, I don't know where my libido is. I just had one patient the other day, she said, you know, my mother told me when you're 38, your libido's gonna peak, and it's never peaked. She's now 54 years old, and we finally got her testosterone levels dialed in. So it's multifactorial, it's diet, nutrition.
And she got her libido back?
Right, so now she's actually sexually active again. It's just actually enjoying it, where before it was a chore for her. And that's what I hear from a lot of women. They say, you know, I just feel bad for my husband because I know he wants to have sex more, and I wish I wanted it more. I almost do it out of obligation. And you can actually change their life by giving them some testosterone, balancing their other hormones, working on them with nutrition and exercise and sleep. So you have, it's multifactorial, but certainly testosterone is a huge piece of that puzzle.
What is the science as far as safety? Or, you know, about testosterone with women?
So testosterone in women, it's been studied by the New England Journal of Medicine. Testosterone levels peak in early adulthood in women just like they do in men. When women have the thickest skin, right? They have the most energy, they have the strongest libido. That's when they look the best and feel the best. Because the science says that testosterone is one of the hormones that will thicken elastin and collagen in the skin. So women will say, you know, I noticed my skin is improved. It's amazing. They spend a lot of money on skin products, and they come in and like, it wasn't until I started using testosterone that my skin improved. So the safety of the side effects of testosterone in women, some women who are sensitive to it, Randy, will notice that they get some acne. But that's usually younger women who are more sensitive to it, and we just adjust the dose.
So you kind of...
Yeah, you can back off the dose, or you could treat the acne. I have some women who, they love how they feel on that dose of testosterone. So they say, can we just treat my acne? Or some women can put up with a couple of pimples here and there. But most women tolerate testosterone very well. It's been studied pretty extensively. But I think as science evolves, you're going to hear more and more about it, because once you fix one woman's libido and she tells all her friends, all of a sudden you have a lot of patients, which is really nice.
Is that what happens in your practice? Like a woman, you know, they tell their friends.
I just had a 33-year-old girl who had a total hysterectomy because she was, she tested positive for a BRCA2 gene for cancer. They yanked out her ovaries. Her libido went to nothing. I got her hormones in balance, worked with her on nutrition. She's feeling amazing. She's already sent me 2 patients in the last week. That's generally what happens when you get patients really feeling well.
Okay. Now energy. Give me, I guess, your best dummied down explanation of how does it give them more energy?
Well, testosterone...
I mean, does it work on the heart? Does it feed the heart? What is it?
So testosterone is protective to your heart, so it dilates the coronary arteries, improves cardiac function. It helps on a cellular level. It works with the other hormones so that you're more efficient. Your cells are more efficient when you're eating, when you're working out. And of course, you know, the more you work out, the more energy you have to go to the gym, the better you feel. So it's multifactorial, but testosterone is certainly anabolic.
So if a woman is 40, Okay, I'm watching this. You're saying at 18 they have higher levels
Yes.
of testosterone, and you're what? You're mimicking. You're bringing their levels back up to where when they were younger.
Exactly. So there's a reference range on labs. And the amazing thing about the reference range is patients come to me and they say, well, most of them, their doctors don't check their testosterone levels, but the ones that do, they say they were in range. And the testosterone, just like in men, Randy, the reference ranges go down as you age. So the free testosterone, the optimal free testosterone for LabCorp is between 2 to 4. If you look at the reference range for a woman who's 40 years old, it's 0.0 to 2.2. So if they're 0.1, they're told they're in range. So commonly you'll see patients that come in, their free testosterone is 0.2, 0.4,
That's very interesting.
0.8. And when you dial them back up to the levels they had when they were 18 or 19 or 20, they actually notice a dramatic difference.
So the ranges go down.
The ranges go down as you age, and that's...
So it's like that's one philosophy of medicine, that's just normal, part of aging?
The reference ranges, especially for hormones, not for a lot of labs, but for hormones, go down as you age because a reference range
And you don't agree with that?
Well, it's not that I don't agree with it.
your
It's physiology,
philosophy
of
is
course.
what?
The philosophy is you want to keep the hormone levels in the optimal range, not for their age. You don't want the testosterone levels.
Interesting.
A 40-year-old woman doesn't want a menopausal or perimenopausal testosterone level. They will feel better if you bring the testosterone levels down to the age when they were 18, or up to the age when they were 18, which is when they looked the best and felt the best. That's when they had like the cleanest, smoothest skin.
Could it make them aggressive?
We don't see it make them more aggressive. We see it make them more assertive. So more drive, determination, more focus, more get up and go, similar to what you see in men when they're on testosterone. It really is not a male hormone, just like it's portrayed in the media. Everybody thinks testosterone in men, testosterone in men. What I'm trying to get them to understand is women make testosterone. It's a very important hormone for women, and it shouldn't be neglected in the medical community like it is. So patients come to me desperate. We look at their testosterone levels. We balance the hormones, not just testosterone, all their hormones. We look at nutrition. We look at lifestyle. We look at sleep. We get that synergistically going together, and they will see dramatic improvement in their health. So Randy, when a woman's considering to start testosterone, it's really critical that they go to a doctor who's competent, who's an expert in bioidentical hormones. They need to be tested. We don't just arbitrarily, randomly throw women on testosterone and say, oh, let's increase your libido. We have to look. I do a very, very thorough blood panel, and we make sure that the levels stay within a normal physiological range, but at the upper end of that range. You don't want to give a woman too much testosterone. If they get too much testosterone, we help dial it back. So it's really important that you just don't take your husband's testosterone and say, well, I'm going to be taking testosterone, because you can absolutely get too much. So it's all about balance.
So if somebody wants to get started, we're out of time. They call your office, make an appointment.
Yeah, they go right to the website, which is drbreen.com. I'll have an educational video on testosterone for them. I'll have what the science is about testosterone and my frequently asked questions, because a lot of times patients want to see science. So go to the website, educate yourself, pick up the phone, call my patient coordinator, and she will walk you through the step of how you become a patient in my practice.
Okay, good. I want to thank you for coming on the show.
You're very welcome. Thank you
interesting.
very much, Randy.
You've been watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.